Hello everyone, myself Dr. Ankur Nayan. I hope you have done pretty well in your previous INI session, and I'm here with the previous year recall of psychiatry. The questions were classy with clinical touch. There was one new diagnosis asked in this exam, but rest of the questions were pretty doable. You can download the workbook from this Telegram channel, and now we'll briefly look into the insights of the questions asked. Okay, so getting set to go. This is the first question. A patient on haloperidol presents with fever, rigidity, autonomic instability, and raised CPK levels. What is the next best step in the management? So we have to first make the diagnosis and then approach the question. The options were A, to stop antipsychotic and administer dantrolene or bromocriptine. B was to continue antipsychotic and conservative management with antibiotics and hydration. C was to start benzodiazepine, and D was to start anticholinergics. So coming to the diagnosis, what is the diagnosis here? In my video on antipsychotics, I taught you the side effects of antipsychotic. When a patient is on antipsychotic and there are conditions like autonomic instability, it's an emergency situation of NMS. What is the triad? In the master table that I gave about antipsychotic, I talked about this condition, NMS, neuroleptic malignant syndrome. What do you mean by antipsychotic? Antipsychotic is also known as neuroleptic. So there is a side effect of antipsychotic, that is NMS. And what is the triad there? MRF, mental status altered, rigidity and fever. And when you do the investigation, there is raised CPK levels due to rhabdomyolysis. So here in the question it was asked fever, rigidity, and this autonomic instability and raised CPK level. So the diagnosis here is NMS, neuroleptic malignant syndrome. And what is the management protocol here? The management protocol is first to stop antipsychotic. Whichever antipsychotic is being administered, you have to first stop it, shift the patient to ICU, and the drug of choice is dantrolene or bromocriptine can be also be given. So the correct option here will be A, stop antipsychotic and administer dantrolene or bromocriptine. Option B, we cannot continue antipsychotic. Antipsychotic needs to be stopped. Okay. Now we'll move to question number 2. What was question number 2? Question number 2 was about delusional disorder, about the type of delusion to match the correct description. Okay, so there were 4 delusions: delusion of grandiosity, delusion of persecution, nihilistic delusion, and delusion of influence. First, we will see the theory of types of delusion. So in my main video about delusion disorders, I taught about this delusion of grandiosity. Patient make false big claims. False big claims of delusion of inflated or unlimited power, wealth, आइडेंटिटी, नॉलेज और ऑथोरिटी. मैंने एग्जाम्पल भी दिया था कि पेशेंट बोलेगा कि मेरे पास तो अंबानी और अडानी दोनों के पैसे जोड़ दो, उससे भी ज्यादा पैसे हैं, तुम्हें कुछ पैसे चाहिए तो बताओ, है ना. सो डिल्यूजन ऑफ इन्फ्लेटेड वेल्थ. He thinks that he is the richest. He has immense amount of property. He is the richest. So this is the delusion of grandiosity. What is delusion of persecution? Delusion of persecution में क्या होता है? Patient को लगता है कि somebody is planning to kill or harm him. Patient is always in suspiciousness mode. Delusion believe that somebody is watching, following, spying or trying to kill or harm him. Okay, delusion of persecution. This is the most common delusional disorder. Then is the nihilistic delusion. Nihilistic delusion is a part of कोटार्ड सिंड्रोम, है ना. कोटार्ड सिंड्रोम में क्या होता है? सब कुछ खत्म हो गया है, ना मैं हूं, ना मेरे आसपास लोग हैं, ये दुनिया भी नहीं है. द वर्ल्ड इज गोइंग टू एंड. आई डू नॉट एग्जिस्ट. आई सीज टू एग्जिस्ट. द वर्ल्ड सीज टू एग्जिस्ट. और द फोर्थ इज डिल्यूजन ऑफ इन्फ्लुएंस. द पेशेंट हैज द डिल्यूजनल बिलीफ दैट हिज थॉट्स और एक्शंस आर कंट्रोल्ड बाय समवन अदर. तो ये हो गया टाइप्स ऑफ डिल्यूजन. सो मैचिंग द कॉलम हियर, डिल्यूजन ऑफ ग्रैंडियोसिटी में क्या होगा? Believe that he is the richest. Delusion of persecution में क्या होगा? Believe that someone is planning to harm him. So A goes with 2 and B goes with 1. और nihilistic delusion में क्या होगा? Believe that the world has ended, nothing is left. And delusion of influence will be believe that his thoughts or actions are controlled by some other. So C will be 3 and D will be 4. So the correct answer is A. Okay. This was about types of delusion. Coming to the next question, question number 3. A young girl presented to the emergency department with sudden loss of vision following a traumatic event in her family. Ophthalmic and neurological examination were normal. The patient was not much concerned about her symptom. What is the most likely diagnosis? So you have to make the diagnosis here. Okay. So we'll see the options one by one. First, conversion disorder. What is the another name of conversion disorder? Functional neurological symptom disorder. Okay. तो conversion disorder का फंडा क्या होता है? There is some traumatic events, which is anxiety or stress provoking stimuli, which is perceived through the conscious mind, but this is sent to unconscious mind by the defense mechanism repression. तो जो स्ट्रेस प्रोवोकिंग स्टिमुलाई है जो कॉन्शियस माइंड परसीव करता है, इट इज सेंट टू अनकॉन्शियस माइंड बाय द डिफेंस मैकेनिज्म रिप्रेशन. बट इन अनकॉन्शियस माइंड जब इंक्रीज इंट्रासाइकिक कॉन्फ्लिक्ट होता है तो दिस इज sent back to conscious mind and it is presented as neurotic symptom like psychosomatic symptom like pseudo blindness, which was given in the question. Sudden onset loss of vision following a traumatic event in her family. So traumatic event is the stress provoking stimuli और इससे प्रोड्यूस हो गया sudden onset blindness. And in conversion disorder there is a phenomena called labella indifference. It's a French term. Paradoxical lack of emotional reactivity despite severity of symptoms. The patient has severe symptom, that is the sudden loss of vision, but she is indifferent to that. She has no emotional reaction to that. कोई मतलब नहीं, ठीक है, हो गया तो हो गया, है ना, सिम्टम प्रोड्यूस हो गया, बट पेशेंट क्या है, मस्ती में है ना, उसको कोई प्रॉब्लम नहीं है. किसको प्रॉब्लम है? यहाँ डॉक्टर्स को. दे आर ट्राइंग टू फाइंड आउट कि क्या हुआ है ना, एंड पेशेंट इज इमोशनली इंडिफरेंट टू द सिचुएशन. उसको कोई सिविरिटी ऑफ सिम्टम से कोई मतलब नहीं है ना, लाबेला इंडिफरेंस. So this phenomena was asked here. The patient was not much concerned about her symptom. दूसरे ऑप्शंस क्या है? फैक्टिशियस डिसऑर्डर. सो ऑप्शन नंबर बी एंड डी, फैक्टिशियस डिसऑर्डर एंड सोमेटाइजेशन डिसऑर्डर. इसमें क्या होता है? जो सिम्टम प्रोडक्शन होता है ना, इफ इट इज डन बाय अनकॉन्शियस माइंड इट विल बी सोमेटाइजेशन डिसऑर्डर. और अगर वो कॉन्शियसली प्रोड्यूस कर रहा है तो इसमें दो कंडीशंस होते हैं. If there is some legal or financial goal or motive, if it is present, then it is malingering. And if it is not present, then it is factitious disorder. इसमें क्या होता है? पेशेंट खुद सिम्टम प्रोड्यूस करता है टू इंजॉय ए सिक रोल, ताकि वो खुद एक पेशेंट के रोल में बना रहे. इसलिए इसको बोलते हैं प्रोफेशनल पेशेंट सिंड्रोम भी बोलते हैं. इट प्रोड्यूस एक्सेग्रेटेड सिम्टम्स टू इंजॉय सिक रोल, टू स्टे इन द हॉस्पिटल, and he is constantly worried about the symptom. और somatization में भी क्या होगा? Preoccupied with bodily symptoms like pain, है ना? There will be multiple bodily symptoms and the patient will have increased anxiety about the symptom. तो इन दोनों केस में जो symptom है, चाहे वो somatization disorder हो, there will be increased anxiety. The patient will be concerned about the symptom, and in factitious disorder also, the patient will be constantly worried about the symptom. So the patient will again be concerned about the symptom. But question में क्या था? The patient was not much concerned about her symptom. Okay. And last was PTSD. PTSD में क्या होता है? कोई भी मेजर लाइफ थ्रेटनिंग इवेंट जैसे मर्डर, रेप, एनी फिजिकल असॉल्ट, एनी डिजास्टर, वॉर, इससे एक महीने बाद अगर कोई सिम्टम आ रहा है, इट इज नॉट सडन, है ना. Mood symptoms like negative mood state, avoidance behavior, avoidance of memories and external reminders. उस जगह को नहीं जाना, उसके बारे में बातें नहीं करना ना, external reminders, people, place, इन सबको अवॉइड करना. हाइपर एराउजल, हाइपर विजिलेंट बिहेवियर होगा, इरिटेबिलिटी हो सकती है, इंसोम्निया होगा. द पेशेंट विल हैव इंक्रीज एंजाइटी और इंट्रूसिवनेस, दैट इज रिकरिंग डिस्ट्रेसिंग ड्रीम्स, नाइटमेयर्स होंगे, डिस्ट्रेसिंग मेमोरीज, है ना, डिसोसिएशन रिएक्शन लाइक फ्लैशबैक्स. द पेशेंट विल बी कंसर्न अबाउट द सिम्टम. इट वाज आस्क्ड अबाउट द पेशेंट इज नॉट कंसर्न अबाउट द सिम्टम एंड इट इज सडन in nature following traumatic event. So here it was asked about a phenomena in which the patient was unconcerned about her symptom, that is labella indifference. So here the correct option will be option number A, conversion disorder. Coming to question number 4, the fourth question was from child psychiatry. It was a new diagnosis asked here. The new diagnosis in DSM-5 है, उसके ऊपर एक क्वेश्चन पूछा गया था. A 7-year-old child has episodes of anger outburst many times a week, which is out of proportion to the situation. He remains irritable for most of the time in between these episodes. The symptoms have been present for 12 months. What is the likely diagnosis? The options were ODD, oppositional defiant disorder, conduct disorder, ADSD, and DMDD, that is disruptive mood dysregulation disorder. Now we'll first go through option number A. What is option number A? Oppositional defiant disorder. इसमें क्या होता है, एक बच्चा होता है which has oppositional behavior. उसको जो भी बोलेंगे उसका अपोजिट करेगा. Defiant, what is it? Means argumentative, argument with authority figures, with parents, with teachers. Disobey and blame others. Here there is episodes of irritability with temper tantrums. जैसे बच्चे को बोलो कि किचन से पानी ले आओ, तो पहले बोलेगा नहीं लाऊंगा, मैं क्यों लाऊं, मैं नहीं लाऊंगा, गुस्सा करेगा, इरिटेट होगा. उसको फिर बोलो कि नहीं लाओ, तो वो जाएगा और जो किचन में पानी रखा हुआ बॉटल उसको भी फेंक देगा, है ना. ही इज आर्गुमेंटेटिव एंड अपोजिशनल, जो बॉटल है उसको भी फेंक देगा. बट इन बिटवीन दीज टेम्पर टॉन्ट्रम्स उसका जो मूड है वो नॉर्मल रहेगा. नाउ कमिंग टू कंडक्ट डिसऑर्डर. कंडक्ट डिसऑर्डर में क्या होता है, यही बच्चा जब आगे चलता है ना, तो इसका निमोनिक है डर. ही विल डिस्ट्रॉय द प्रॉपर्टीज, डिस्ट्रक्शन ऑफ प्रॉपर्टीज, आसपास जो चीजें हैं उसका तोड़फोड़ करना सोसाइटी में. एग्रेशन टुवर्ड्स पीपल एंड एनिमल्स, क्रूएलिटी टुवर्ड्स स्ट्रे डॉग्स, क्रूएलिटी टुवर्ड्स एग्रेशन, शोइंग एग्रेशन टुवर्ड्स पीपल, है ना. और जो रूल्स है, सोसाइटल रूल्स है, उसको फॉलो नहीं करना है, टू वॉयलेट द रूल्स. कंडक्ट डिसऑर्डर. एडीएसडी में क्या होता है, सिम्टम्स दो ग्रुप में होते हैं, हाइपर एक्टिविटी, इंपल्सिविटी और इनअटेंशन. बट दीज वेर नॉट आस्क्ड इन द क्वेश्चन. व्हाट वाज आस्क्ड इन द क्वेश्चन वाज a new diagnosis, DMDD, disruptive mood dysregulation disorder. This is a screenshot from DSM-5 TR, which I read during my MD days. And here the diagnostic criteria is given: severe recurrent temper outburst, that is anger outburst, which is out of proportion to the situation, 3 or more times per week, and the total duration is for 12 or more months. तो यही ऑप्शन में था, एंगर आउटबर्स्ट विच आर आउट ऑफ प्रोपोर्शन टू द सिचुएशन, एंड दीज सिम्टम्स हैज बीन प्रेजेंट फॉर more than 12 weeks. And what was more important, that he remains irritable for most of the time in between these episodes, which are not in case of other options. तो अगर अपन DMDD का मूड चार्ट देखें तो कैसा बनेगा, ऐसा बनेगा: patient is irritable, then there is anger outburst, then there is anger outburst, but in between anger outburst also the child is irritable. So this is DMDD. अब अगर पेशेंट का मूड इन बिटवीन नॉर्मल हो जाता है बट फिर भी दे आर रिकरेंट एंगर आउटबर्स्ट, तो ये क्या डायग्नोसिस हो सकता है, इंटरमिटेंट एक्सप्लोसिव डिसऑर्डर. एंड आई थिंक इन द नेक्स्ट एग्जाम्स दिस विल बी ऑल्सो ए पोटेंशियल क्वेश्चन. तो यहां पे करेक्ट ऑप्शन क्या जाएगा, DMDD. Option number D, disruptive mood dysregulation disorder. Okay, so this was the question number 4. Now the next question was on sexual paraphilias. Question number 5, a man derives sexual gratification by touching inanimate objects like female undergarments and sandals. Which of the following is the most likely diagnosis? It was a pretty simple question, previous year question. So option number A, frotteurism is sexual gratification by touching or rubbing one's genitalia against non-consenting person. She is the non-consenting person and he is touching her. Okay, so this is punishable under BNS 75, Bharatiya Nyaya Sanhita 75. The second option, voyeurism, is sexual gratification by watching private acts of others, like if somebody is having sex or if someone is nude taking a bath, and if one is seeing that, it is called peeping tom or escopophilia, and it is punishable under BNS section 77. Option C, fetishism. It is sexual gratification by touching or seeing inanimate objects like footwear, undergarments, and this was asked in the question. And option D, exhibitionism was sexual gratification by exposing one's private part in public area, and this is punishable under BNS section 296. So the correct option here will be option number C. And now the last question of forensic psychiatry. A person kills his friend under the assumption that he was planning to kill him. He was later diagnosed with schizophrenia. Which of the following statements, as per McNaughton's rule, would be appropriate? He is not fit to stand trial. He is guilty for the act. He is partially guilty for the act. And option number D, not guilty if he was not aware of the nature of his act. So basically, McNaughton's rule was being asked. So what is McNaughton's rule? Under section 22 BNS, it is also known as right or wrong test or legal test for insanity. It states that a person is not considered criminally responsible if at the time of committing the act, जब उसने act commit किया, is there a reason for unsoundness of mind? He is incapable of knowing the nature of the act and did not know that what he was doing was either wrong or contrary to the law. अब यहां जो पेशेंट ने क्राइम करा, at the time of doing the crime, at the time of killing his friend, he was with unsound mind, in schizophrenia. Yes, in schizophrenia क्या होगा? Patient with mental illness, unsound mind, and he is not capable of knowing the nature. किसी का मर्डर कर रहा है, but patient with schizophrenia is not able to know the nature of the act. And the third point, did not know what he was doing was either wrong. और जब वो अपने दोस्त को मार रहा था, he was not aware कि जो वो कर रहा है ना वो गलत है या फिर लॉ के अगेंस्ट है. And these were asked in the options ना, not guilty if he was not aware of the nature of the act, है ना. तो the correct option here will be option number D, not guilty if he was not aware of the nature of his act, as the patient has unsound mind and he was not aware of the nature of the act. Section 22 BNS, McNaughton's rule. So these were the questions. I hope most of you have done 5 out of 6. Yes, there was a new diagnosis, but exclusion करके आप उसको भी solve कर सकते थे. So you can go through this video, and for upcoming exams, you can get an idea about how to approach the question. Okay. So thank you, and we'll meet in the next session.